Hi everyone, this is Dr. Rufus Vasanth Raj, Senior Consultant Orthopedic Surgeon, Specialist in Arthroscopy, Trauma, Sports Medicine and Joint Replacement. Today we are going to discuss about osteoporosis. As the name suggests, what is osteoporosis? Osteo plus porosis. Osteo means bone, porosis means porotic. That means the bone is very weak, it is fragile, it's brittle. So this condition called as osteoporosis is very common. If you Google search about it, the first line which comes says that it's a silent disease. So what does it mean? It's a silent disease means most of the times we don't even know that we have osteoporosis. It goes gradually. It progresses gradually and slowly, and suddenly at one stage you realize it. So the stage when you realize and wake up, it is actually a little bit late. So that's the reason why I wanted to talk about osteoporosis, because it's a very important topic for everybody today. So who gets osteoporosis? If you look at it, it's very common sense that bones become weak when you become old. But is that the only criteria? No. In general, we believed for a long time that anybody who is 65 plus can get osteoporosis. But nowadays, we also realize that post-menopausal osteoporosis is very common. A lot of women attain menopause even at 40s and 30s. So the post-menopausal osteoporosis, because of the drop in estrogen, is very common, and we also realize that osteoporosis happen for a lot of younger male individuals also. What could be the reason? Drop in testosterone, bad lifestyle like smoking, drinking, carbonated drinks, not having a proper sleep, not eating properly at time. All these things do contribute to osteoporosis. The recent thing which is commonly discussed is actually the stress factor. Osteoporosis can also happen for people who have other kinds of diseases like excess thyroid or parathyroid hormone functions. And in addition to that, people who take steroids for multiple reasons can get osteoporosis. So now we discussed who gets osteoporosis, so how to find it. As I said before, it's a silent disease. So most of the time, people don't even know that they have osteoporosis. They keep moving around, they keep looking very normal, but there are few small tricky things which we can find out very easily. The first thing is that you get tired easily. So what you need to understand is that your entire body, the main skeleton is made up of bones. All the muscles, everything is attached to the bones. So skeleton forms the main thing. So many times patients complain that I feel easily tired, and when I get a fever or something, I take a longer time to recover. I just exerted a bit, but still I have a lot of pain, lot of discomfort. I feel very tired. So this is a very classical symptom. Second thing is that osteoporotic silent fractures. What do you mean by silent fractures? If you look at your spinal column, the bones are almost square shaped. So you need to understand it's like a big tall tower with a lot of square shaped bones. So these bones can break. Break in the sense they don't break into half. They are called as osteoporotic compression fractures. So basically they get compressed. So somebody who has got an osteoporotic compression fracture will have a vague back pain. Usually it happens in the mobile segment, that is between the thoracic and lumbar vertebra, because the thoracic vertebra is the place where the ribs attach, so it doesn't move. The lumbar vertebra is below the thoracic vertebra where the spine moves more freely. So people do develop these osteoporotic compression fractures. They have some mild back pains, and some people even classically say that their spine is bending forward. Some people say that my height has little bit become less. So all these are very classical of osteoporotic spine fractures. In addition, the most common thing which most of the times when patients come to us are, doctor, I had a small fall. I just slipped and kept my hand down on the floor, but my hand is fractured. Doctor, I just slipped a step and I fell down, my ankle is fractured. So all these are very classical of osteoporotic fractures. The biggest challenge for us is that elderly people, when they have osteoporosis, when they fall down, they have hip fractures, which are a little bit difficult to treat, because most of the patients who have hip fractures ultimately need a surgical intervention. And these patients, when they undergo a surgical intervention, the mortality rate, that is post-surgery, the years of living is going to really come down. So we take it a little bit seriously about osteoporosis and osteoporotic fractures. So first we discussed about why it comes, second we discussed about how it comes and what we feel about it. Third thing is that how to diagnose it. There are few investigations to find osteoporosis. DEXA scan is considered the gold standard. DEXA scans are usually done in scan centers where you lie down and a mission passes around you. It is more of an X-ray related mission which has got a radiation, but it clearly indicates and clearly shows which all part is osteoporotic. It specifically denotes your hip, knee, spine and everything. So the other important investigation is called as a BMD, ultrasound guided investigation, because since DEXA scan has got a high radiation. Sometimes you can't do it for pregnant women, children, and some people don't like it because it's got a radiation. In such situations, we can use an ultrasound guided BMD mission. BMD mission is less sensitive and specific when compared to a DEXA scan, but more or less it's very, very useful. So once we find out that you have a osteoporosis, now comes the treatment part. The common question which people ask is that, sir, how to improve the bone strength? Can I eat a lot of food? Can I eat a lot of non-veg? Can I eat a lot of vitamin Ds and calciums? No. Unfortunately, most of the things ultimately don't have any impact. So the wrong concept is that many people think that post-menopause or generally if you take a lot of calcium, osteoporosis can be prevented. No, it's not true. In osteoporosis, basically you need to understand that you have two kinds of cells in your body, osteoblast and osteoclast. So osteoblast produces bones and osteoclast eats up your bone. So osteoporosis is a very classical indication of an imbalance between these two. So our aim is to either prevent the more bone eating cells being formed or increase the bone forming cells. So common things are called as bisphosphonates. They do come in tablet form. Some people tolerate it, some people don't tolerate it because it's given weekly once, because a lot of acidity and other side effects. So nowadays we have moved more into injections. So injections for osteoporosis are very, very simple because they are just subcutaneous injections. So you know what is subcutaneous? Like how an insulin or a diabetic injection works. The needle is very small, so when you inject it, it just goes below the skin and stops. It doesn't go into your muscle or bone, so it doesn't hurt. So we have teriparatide injections, which are hormonal injections which go and increase your bone formation. We also have iron injections like denosumab. Denosumab MAB, basically denosumab MAB is a monoclonal antibody. It is given once in 6 months and gradually increases your bone strength and your bone density. So osteoporosis can be treated. The most common wrong idea is that osteoporosis is not treated. Once you become old, definitely you have osteoporosis. So there's no treatment options at all. All these things are not true. In reality, in orthopedics, it is very easy to treat osteoporosis. The biggest factor is that the biggest struggle which you go through is to diagnose osteoporosis. Many patients don't know that they have osteoporosis. Many patients unfortunately come to a doctor only when they have a fracture. Many times when we do a surgery for a fracture, we then realize that the patient is so weak, the injury is so trivial, a small fall causing a fracture, then we treat osteoporosis. That is ideally not the correct way to go forward. In many abroad countries nowadays, they make a BMD or a DEXA scan compulsory in their mast-cell checkup. In India, unfortunately, mast-cell checkup usually contains few blood tests and some few scans around the abdomen. But in orthopedics, we are very specific about the bone strength. So anybody who is 65 plus, because 65 plus is called as elderly, or anybody who is post-menopausal, anybody who has got a hectic lifestyle, a lot of stress, bad food and sleeping patterns, they are all clear patients for osteoporosis. We need to first diagnose them, as I said before, a DEXA scan or at least a BMD, ultrasound guided mission. These two things can clearly diagnose an osteoporosis. Once osteoporosis is diagnosed, we need to treat it aggressively and it can be completely reversed. So osteoporosis is treated with proper injections. The duration of injections is a controversy because nobody knows how long we have to give. If you look at teriparatide, it can be given maximum up to 2 years continuously. If you look at denosumab, it can be given up to 4 years, once in 6 months. But how long is a question mark? Because what we realize is that the genetics and your general lifestyle makes a big difference. People who are much younger, people who have a better lifestyle, good exercise, good eating habits, they all respond to this injection much faster than regular patients who have bad lifestyle. So injection, once we start it, our aim is to bring you to normal. Once a DEXA scan or a ultrasound BMD shows that you are normal, you don't need to take any more injections. You just need to stop it and maybe yearly once we can check it out. So the take home message for osteoporosis is that it's very simple. What you have to understand as a whole is osteoporosis. Osteo means bone, porosis means the bone becomes very weak and it's easy, fragile and brittle. It's a silent disease, so it's very difficult to find out. The first step is always that mild symptoms like easily becoming tired, small falls causing fractures, all these are very clear indications of osteoporosis. Always meet an orthopedician. An orthopedician will obviously guide you in taking a DEXA scan or a BMD ultrasound guided investigation. These investigations give a clear picture about your nature of osteoporosis. In fact, in osteoporosis, the scoring is done. If you look at the scoring part in the DEXA scan or a BMD, we will say that above minus 1.0 is normal, minus 1.0 to minus 2.5 is osteopenia and less than 2.5 is osteoporosis. So when somebody is diagnosed with osteoporosis or even osteopenia, we try to give all these injections which are already explained and then we slowly increase your bone strength and your bone thickness and bring you to a normal range. The moment you come to a normal range, you suddenly feel that you are around 5 to 10 years younger because your bones become more stronger. You feel more stronger in walking, your general lifestyle improves. You don't become tired so easily. Even a small injuries, or even if you fall from a bike, sometimes you don't have a fracture. Because many patients ask me that we two traveled on the same bike, one of us got a fracture, the other person didn't get it. Most of the times because your bones might be weaker. Because a similar fall from two individuals and one person alone getting a fracture is a very, very clear indication that that patient's got a osteopenia or osteoporosis. So the take-home message for you is that osteoporosis is a silent disease, but don't worry, it can be 100% treated and reversed. So as a doctor, there are two common things which I see as osteoporotic fracture. The one thing is that a spine fracture. Most of times a spine osteoporotic fracture doesn't need a surgery. We try to treat it with osteoporotic injections, reversal injections. We try to treat it with osteoporotic reversal injections, give a good spine brace and monitor them closely. But sometimes if the fracture is very bad, we call it a burst fracture or an injury which is causing a bigger fracture line, in such situations your spine fractures might need a surgery. Unfortunately, when you have an osteoporotic fracture involving a hip, so we call it as a neck of femur or an intertrochanteric fracture. So what I am trying to say is that your thigh bone, which is called as a femur, attaches to your hip bone, which is called as a pelvis. So the place where it attaches, we call it as a ball and socket joint. Sometimes the ball can get fractured, which is something which I very commonly see. If the ball gets fractured, then obviously you need to do a joint replacement for the hip. If the ball is not fractured and a little bit lower down its fracture, we call it as an intertrochanteric or a subtrochanteric fracture. In such situations, we can fix it with implants. So unfortunately, as I said before, all hip fractures, especially in osteoporotic patients, we need to do a surgical intervention because if you don't operate, they can't walk. If they don't walk and they lie down for 6 weeks, they end up with a lot of complications like bed sores, urinary infection, chest infection, other things. So you need to understand that osteoporotic fractures, the common ones are spine, hip, and the next is your wrist, which is called as distal radius. Distal radius fracture, again, most of the times are treated conservatively with plaster of Paris. Most of the times are treated conservatively with plaster of Paris or braces and along with injections. But the only catch here is that, as I said, in my clinical practice, I have maximum seen osteoporotic fractures involving the hip, spine or the wrist, out of which wrist most of the times is conservative, doesn't need a surgery. Again, spine most of the time is conservative, doesn't need a surgery, but hip fractures unfortunately need a surgical intervention. So that's the one thing which I said before also, hip fractures have a high mortality rate. That is, even though we fix the hip fractures, we believe that in the world registry, anybody who is having a hip fracture, osteoporotic and then getting treated, even though we make them walk on the same day, we try to mobilize them as early as possible, the next 1 or 2 years, their mortality rate, their chance of living through is very, very low. The mortality rate is very, very high. So anybody who has got an osteoporosis, anybody who has been diagnosed with osteoporosis, please don't panic. I can properly treat it. We doctors are there for you. We'll meet again with one more interesting topic. Thank you.